There are so many different populations that we're worried about right now when it comes to COVID-19. But a group of kids who we haven't really been thinking about is the 10,000 children who are in Kentucky's foster care system. Quarantining and social distancing can actually be quite dangerous for some of them. Here's how.
We have almost 10,000 kids in foster care right now in the state of Kentucky, and we know that there are other children who are also experiencing abuse and neglect. And right now, we don't have full assurance because of the situation with COVID-19 that these kids are going to have eyes on them. And so the number one concern, not just for Boys and Girls Haven, but for social workers around the state, is the safety of our kids, and recognizing that, this has created a really unprecedented challenge for identifying situations where kids might be in danger.
A lot of times, the way we find out that abuse is happening is once kids are in school. And so if they're not in school, teachers aren't seeing the bruises, the signs of neglect and abuse. And so now we've already taken out a level of people seeing them, and now the state workers can't see them.
Think of mandated reporters as being teachers, pediatricians, coaches, after school staff, people that would have their eyes on these kids all the time, that might be able to see when a family is in crisis. They might see the physical signs or psychological trauma that a child would be experiencing. And we don't necessarily have those mandated reporters who are now having eyes on the kids, and it's a big concern.
When it comes to social visits and biological parents who are trying to work on things with their family and see their family, what is the answer?
We're all trying to figure it out at the same time. It's just like healthcare field. We're seeing things we never expected to see. And so there's a lot of safety calls that the governor has made and that the cabinet has made to keep our social workers safe, our families. So this is a really frightening time.
There are so many other issues that we're seeing pop up within the child welfare system because of the coronavirus. And unfortunately, most of the consequences that we're seeing are not good. In Louisville, Christina Mora, WLKY.